The second article that I found in the EBSCO database was one by Zhang, Rao, and Chong. And this one was in regards to the prevention of gestational diabetes. And they reviewed several different studies to try to find what has been working as far as gestational diabetes prevention. And what they found is that there are many factors that can indicate that gestational diabetes might eventually be an issue. Those things were maternal age, a family history of diabetes, gestational diabetes in a previous pregnancy, having an infant that's already too large, non-Caucasian race, already being overweight or obese prior to pregnancy, and cigarette smoking. So in addition to that, they found that diet and lifestyle habits before and during pregnancy were associated with the woman's risk of either getting gestational diabetes or not getting gestational diabetes. So if the woman had a diet and a lifestyle that was healthy prior to pregnancy, she was less likely to get gestational diabetes with her pregnancy, and vice versa. Having an unhealthy diet and lifestyle led to higher chances of having gestational diabetes. So they studied a total of 361 cases, and they found that greater than 20% of those cases had a reduction in risk when physical activity was implemented early in pregnancy. And that really just kind of supported the findings of my other article, as far as moderate to intense exercise being implemented prior to pregnancy and also in the first trimester of pregnancy. So I felt like this article very much supported the things that are already being done as far as gestational diabetes control. Like I mentioned previously, taking blood sugars, eating a prescribed diet that's high in like leafy vegetables, low in carbohydrates, basically a diabetic diet that we would give to a type 1 or type 2 diabetic for gestational diabetes, and also the exercise program. So both of these articles really kind of they solidified the things that are already being done in current practice, but neither one of the articles mentioned the possibility of keeping a log or a tracker of those three items in order to help these patients better manage their diabetes and to stay on track, much less meeting with a nutritionist in order to help them have that accountability and be able to stay on track with their gestational diabetes management. So as a result, there were several things that we found. It was the vigorous to moderate to vigorous activity, eating a diet low in carbohydrates, eating a diet low in red meat, eating a diet high in green leafy vegetables, eating lots of fiber, not smoking, and participating in weight loss programs prior to becoming pregnant if the woman was already obese or overweight. So in order to implement these things, I suggest that a log be kept either in a paper form if the patient is more comfortable with that, or in an app form. On your phone you have millions of apps, you have games, you have calculators, you have all these crazy things. Why not have another app during your pregnancy that helps you track your blood sugars, your diet, and your exercise? And then you're able to take this with you because you're already going to have your phone with you, and go to the nutritionist or email them prior to actually seeing them so that they can identify where you're strong in your lifestyle as far as managing your gestational diabetes, and also where you might need a little bit of extra help. So I think that would be something that's really great, is making sure that you find a log that works for your patient, whether it be paper, electronic, or some other form that the patient might just kind of feel more comfortable with depending on what they're already doing in their lives. So my teaching plan for this project was to teach fellow nursing students about the evidence-based practice of gestational diabetes and how it's being managed, as well as having a tracker or a log that were to be used to help these patients manage their gestational diabetes better. I think it's important for all nurses, especially those that are interested in OBGYN, but all nurses, whether it be ICU, med-surg, wherever you might be, to know about gestational diabetes, because you never know when you might have that patient that's pregnant, whether it be almost full term or 30 weeks that might come into your ICU unit because, you know, she was in a bad car accident, but she's not quite ready to deliver that baby, and she has gestational diabetes. I've seen it happen before where these patients are on ICU units, and the labor and delivery nurses come once a day to track the baby's heart rate just to make sure everything's okay on that end. But otherwise, the ICU nurse or the med surg unit nurse is in charge of that patient and the care of that patient. So it's important for everybody to have a solid understanding of gestational diabetes and, causes, ways to prevent it, just so that in that off chance that you have that patient, that you're able to help them and give them that education that they need, especially in those types of situations. So this presentation is obviously being done online in a video format. I'm in a remote location. I'm currently living in Utah rather than in Florida, so it was not possible for me to do a live presentation. However, I feel that this is beneficial for me because not only do I have this presentation to potentially show to future patients or future nurses, but it's also something that most people can have access to if they have simple access to the internet. So as far as my teaching plan goes, I decided to use a brochure style because I feel like most people like having something solid in their hands that they can hold, they can look, and it's paper, you can take notes on it. So on pages in the appendix C, you'll find that there is the appendix B, pages 21 and 22 is the brochure that was created for this project. On the front page, it's listed gestational diabetes, and it looks much better on the computer. And so obviously, were this project to be implemented, it would be printed in a professional setting. But the first page says gestational diabetes and has a woman holding a bowl of salad because that's appropriate if you're trying to teach someone that they need to eat healthier because they have this gestational diabetes. So you open it up, and this first page here kind of mentions the risks. And I've already gone over this previously in my introduction. The risks really are that you can have a baby that's large for gestational age, resulting in a cesarean section. You can have a shoulder dystocia, which can lead to permanent harm or death. And you can also have infants born that are having trouble maintaining their blood sugar. So this kind of introduces you to why we might want to better manage gestational diabetes, because these are the negative things that can happen when you have gestational diabetes that are not being controlled. So then you open up the folder, and over on this side, I kind of did a overview of the current practices that are being used, and that's the tracking your blood or monitoring your blood sugar, eating a prescribed diet, and exercising. But unfortunately, it's not enough, and because many of these patients are coming to labor and delivery and they're admitting that they didn't follow the prescribed plan because they were educated once or maybe twice about what they were supposed to be doing, and then they just kept doing what they were doing prior. And unfortunately, their gestational diabetes was not managed, and their infants come in huge, and again, they're at risk for the things that I mentioned. So, is there a better way to manage gestational diabetes? And the answer is yes. Like I mentioned prior, having a log, whether it be a paper, electronic, or some other form to manage those things, would be beneficial to these patients, because not only does it give them the visual of, oh, this is what's happening. They're able to start seeing patterns. They're able to have that accountability. Just writing it down is a little bit of an accountability, because they're saying, oh, I really did eat 3 candy bars or 4 candy bars, whatever it is. I know that's a ridiculous number, but for some people that's a reality. And when they know they have to write it down, it may be that they're only going to eat that one instead of however many, because they know that they're going to have to write it down on that paper. And not only that, but if you have a nutritionist involved later down the line, they know that they're going to have to be held accountable, not in a negative way, but to that nutritionist, so that they just kind of know in the back of their mind. And so I think they would be more likely to follow those prescribed diet, exercise, and blood sugar tracking methods when they know that there's somebody that's going to be reviewing it periodically. So the things that I suggest change as far as gestational diabetes management are keeping a log, which I've mentioned, meeting with a nutritionist, and also implementing an exercise plan, because an exercise plan without diet, a great diet without exercise is really only half the battle. If you're able to get both of those things in check, then you can really manage your gestational diabetes in a positive way. And then on the very back, I just have my contact information, Samantha Zimmer, registered nurse, with my school email address, and then the references that were used for this brochure. So I feel like this came together quite nicely. I think that this is something, like I said previously, it's solid. It's something that people can take with them. It's something that they can refer back to, not only nurses, healthcare providers, but if it was adjusted just a little bit, patients can use it, to help them better manage what they, what they need to do for the management of their gestational diabetes. So, in conclusion, there is definitely a need for better management of gestational diabetes. I've seen too many situations where these mothers come in and they end up in a bad labor situation because their management of gestational diabetes was lacking or non-existent. And so I think that by better educating our healthcare providers, our nurses that are interacting with these patients in a prenatal setting, to educate these patients on how to better manage their gestational diabetes can help us to prevent these injuries that are happening to these patients and these infants because of this type of situation. I know that there will potentially be an increased cost as far as utilizing a nutritionist and possibly implementing a log that you're giving to your patient, like I said, whether it be paper or electronic. But I think that the benefits and the consequences compared to the health and well-being of the mother infant far outweigh any extra expense that might be incurred. So I appreciate you taking the time to listen to my presentation. I hope you enjoyed it, and I hope you learned something about gestational diabetes. And I hope in the future that keeping a log and tracking all these things with gestational diabetes may become the current practice based off of some evidence-based practices. Thank you.